Peripheral vascular disease. The best treatment options. The term peripheral vascular disease is commonly used to refer to peripheral artery disease, meaning narrowing or occlusion by atherosclerotic plaques of arteries outside of the heart and brain. Risk factors for peripheral artery disease include elevated blood cholesterol, diabetes, smoking, hypertension, inactivity, and overweight, obesity. A small percentage of people over the age of 50 are believed to suffer from peripheral artery disease. The symptoms of peripheral artery disease depend upon the location and extent of the blocked arteries. The most common symptom of peripheral artery disease is intermittent claudication, manifested by pain that occurs while walking and dissipates at rest. Doctors may use radiologic imaging techniques including Doppler ultrasound and angiography to aid in the diagnosis of peripheral artery disease. Peripheral artery disease can be treated by lifestyle alterations, medications, angioplasty and related treatments, or surgery. A combination of treatment methods may be used. Complications of peripheral artery disease include sores that do not heal, ulcers, gangrene, or infections in the extremities. In rare cases, amputation may be necessary. Having peripheral artery disease usually indicates the potential for arterial disease involving the coronary arteries within the brain. Atherosclerosis. Atherosclerosis is a gradual process whereby hard cholesterol substances are deposited in the walls of the arteries. Cholesterol plaques cause hardening of the artery walls and narrowing of the inner channel of the artery. The atherosclerosis process begins early in life. When atherosclerosis is mild and the arteries are not substantially narrowed, atherosclerosis causes no symptoms. Therefore, many adults typically are unaware that their arteries are gradually accumulating cholesterol plaques. But when atherosclerosis becomes advanced with aging, it can cause critical narrowing of the arteries resulting in tissue ischemia. Atherosclerosis causes disease. There are two ways atherosclerosis causes disease. Atherosclerosis can limit the ability of the narrowed arteries to increase delivery of blood and oxygen to tissues during periods of increased oxygen demand such as during exertion. Complete obstruction of an artery by a thrombus or embolus resulting in tissue necrosis. Exertional angina and intermittent claudication are two examples of insufficient delivery of blood and oxygen to meet tissue demand, whereas strokes and heart attacks are examples of death of tissue caused by complete artery obstruction by blood clots. There are many similarities between coronary artery diseases and peripheral artery disease, and the two conditions may coexist in the same individual. Complications of peripheral artery disease. In rare cases, the decreased circulation to the extremities characteristic of peripheral artery disease can lead to open sores that do not heal, ulcers, gangrene, or other injuries to the extremities. These areas that do not receive adequate blood flow are also more prone to develop infections and, in extreme cases, amputation may be necessary. Risk for peripheral artery disease. Peripheral artery disease is a common condition that affects approximately 10 million adults in the U.S. About 5% of people over the age of 50 are believed to suffer from peripheral artery disease. Peripheral artery disease is slightly more common in men than in women and most often occurs in older persons. The known risk factors for peripheral artery disease are those that predispose to the development of atherosclerosis. Risk factors for peripheral artery disease include high blood levels of the bad LDL cholesterol and triglycerides, low blood levels of the good HDL cholesterol, cigarette smoking, diabetes mellitus, high blood pressure, hypertension, or a family history of hypertension, a family history of atherosclerotic disease, chronic renal failure, overweight or obesity, physical inactivity. In peripheral artery disease, the risk factors are additive, so that a person with a combination of two risk factors, diabetes and smoking, 4. Example has an increased likelihood of developing more severe peripheral artery disease than a person with only one risk factor. Symptoms and signs of peripheral artery disease. Approximately half of people with peripheral artery disease do not experience any symptoms. For patients with symptoms, the most common symptoms are intermittent claudication and rest pain. Intermittent claudication refers to arm or leg pain or cramping in the arms or legs that occurs with exercise and subsides with rest. The severity and location of the pain of intermittent claudication vary depending upon the location and extent of blockage of the involved artery. The most common location of intermittent claudication is the calf muscle of the leg, leading to leg pain while walking. The pain in the calf muscle occurs only during exercise such as walking, and the pain steadily increases with continued walking until the patient has to stop due to intolerable pain. Then the pain quickly subsides during rest. Intermittent claudication can affect one or both legs. Oxygen supply to the lower extremities even at rest and represents a more serious form of the condition. The pain typically affects the feet, is usually severe, and occurs at night when the patient assumes a supine position. Other symptoms and signs of peripheral artery disease include numbness of the extremities, weakness and atrophy of the calf muscle, a feeling of coldness in the legs or feet, changes in color of the feet turn pale when they are elevated, and turn dusky red in dependent position. Hair loss over the dorsum of the feet and thickening of the toenails. Painful ulcers and or gangrene in tissue where there is critical ischemia, typically in the toes. Treatments for peripheral artery disease. Treatment goals for peripheral artery disease include relieve the pain of intermittent claudication, improve exercise tolerance by increasing the walking distance before the onset of claudication, prevent critical artery occlusion that can lead to foot ulcers, gangrene, and amputation. Prevent heart attacks and strokes. Treatment of peripheral artery disease includes lifestyle measures, supervised exercises, medications, angioplasty, and surgery. Lifestyle changes. Smoking cessation eliminates a major risk factor for disease progression and lowers the incidences of rest pain and need for amputations. Smoking cessation is also important for the prevention of heart attacks and strokes. A healthy diet can help lower blood cholesterol and other lipid levels and may help control blood pressure. Keep other risk factors, such as diabetes, lipid levels, and blood pressure under control by following medical advice regarding medications and lifestyle changes. Surgery for peripheral vascular disease. Surgical treatment for peripheral artery disease involves either bypass surgery performed by a vascular surgeon or endarterectomy. Indications for surgical treatment of peripheral artery disease include lesions that, for anatomical reasons, may be difficult to treat by angioplasty. Examples include lesions covering long segments of a vessel, vessels with multiple narrowed areas, or long areas of narrowing. Bypass surgery involves using a vein from your body or a portion of synthetic vessel to create a detour around the blockage. One end of the graft is sewn to the damaged artery above the blockage and the other end is sewn below the blocked area. Blood flow is then able to bypass the area of narrowing or blockage. Bypass surgery is a major surgical procedure requiring general anesthesia and a hospital stay. Endarterectomy is a procedure in which the surgeon cleans out plaque buildup inside the artery of the affected leg or arm.